Most clinics schedule Shockwave once a week. But here's what almost nobody asks. Does your body actually need 7 full days to recover? Or is that just what everyone's been copying for decades? Because here's the truth. That once a week rhythm didn't come from biology. It came from early research setups. And it stuck, even when your body needs something a little bit different. So today, I'm going to break this down for you. Why weekly became the habit, what's actually happening in your tissue after a session, and how we might shockwave for athletes, busy adults, or older adults with arthritis, so you not only feel better, but stay better. I'm Dr. Jason Hahn, board certified sports clinical specialist and founder of HealthFit in Pasadena. We help athletes push performance and help older adults move with confidence again. No cookie cutter care, just smart recovery that fits your life. All right, let's start with the history. Back in the 1990s and early 2000s, the first big studies on shockwave were done once a week for 3 or 4 visits. People improved, so clinics copied it, and once a week became the standard. And that was just a study design, not a biological rule. It's a good starting point, but not the only option your body responds to. So, what's actually happening after a session? Let's make this simple. Within minutes to hours, your cells get a wake up message. The repair switch is on, growth factors kick in, and it's like flipping the ignition. Over the next 24 to 72 hours, the blood flow increases, nitric oxide spikes, and you hit this short performance window. That's why so many people feel looser or lighter right after treatment. Around day 1 to 2, there's a small controlled inflammation. That's not a setback. That's your body organizing the fix, like a construction crew clearing out old debris before rebuilding. Then, over the next few days to weeks, new collagen fibers form, tiny blood vessels grow, and tissue starts to remodel. That is the long game, where the real strength and mobility come back. Here's the key. The loud repair signals fade by about 72 hours, but the deeper remodeling, it keeps going whether you come back on day 4 or day 7. Your body doesn't care what day of the week it is. It cares what state it's in. And that's the heart of this whole conversation, because pain is data. We just have to decode it. So, how do we time the sessions for different problems? For tendon issues like Achilles pain, plantar fascia, tennis elbow, rotator cuff, most adults do best every 5 to 7 days. That's enough time for tissue to adapt before the next hit. For athletes, especially in training season, we might tighten it up every 72 to 96 hours to sync with their practice and recovery cycles. For muscle or fascia pain, where we use the gentler radial pressure wave, we often go every 2 to 3 days. It's more surface level, more movement and recovery than deep remodeling. For arthritis or degenerative joints, like the knee, the hip, the shoulder, or the spine, we start focused sessions every 5 to 7 days. Once stairs or daily movements feel easier, we gradually space things out. If the area is really sensitive, we may start every 7 to 10 days for focused work. To add radial treatments, maybe every 2 to 3 days to relax the muscles around the joint. That's how you blend biology with reality. You meet the body where it's at. Now, does the research actually support weekly? Yes, but with context. Most early studies showed good results after 3 weekly sessions for tendon pain. But remember, that was a research schedule, not a rule of nature. At HealthFit, we start there, then fine-tune spacing based on your healing speed, your age, and recovery style. Like I always say, test, don't guess. Let me give you 2 quick stories. Marcus, 32 years old, a weekend soccer player. He came in with mid-Achilles pain that had been bugging him for months. We started focused shockwave every 5 to 7 days and tightened to every 96 hours when he came back-to-back games. And then we paired it with smart calf training, isometrics, then eccentrics, and power work. By week 2, he was warming up faster, less stiffness in the morning. By week 4, he was sprinting full speed again, and pain came down from a 6 out of 10 to a 1. Then there's Evelyn, 68, retired teacher. She had 10 years of knee arthritis and dreaded the stairs. We started focused sessions every 7 to 10 days. We added radial pressure wave to her quads and her calves every 2 to 3 days. Plus, short walks and sit to stands at home. By week 3, less night ache. By week 5, smoother stairs, fewer pain pills. By week 6, She was walking around the grocery aisles without laying on her cart. Different people, different timing, same principle. Time your care to your biology. So if you came to our clinic, here's what we'd do. First, we'd figure out what's irritated, your tendon, muscle, or joint, and what goal matters most to you. Then we'll pick the right tool. Focus Shockwave for deep tissue, radio for muscles and fascia. Next, we'd set your timing. Tendons every 5 to 7 days, or 72 to 96 hours if you're training. Muscles every 2 to 3 days. Arthritis starting 7 to 10 days, then moving to 5 to 7. Then we add smart loading. For tendons, pain-tolerant isometrics, then eccentrics, then power work. For arthritis, short, frequent walks, glute and quad strength. We'd layer in recovery basics such as sleep, hydration, protein, and daily step goals. And finally, your timeline. Most people notice a shift by visit 3 to 5 and steady progress over 6 to 8 weeks. Now, a few common questions we get all the time. If recovery comes in 72 hours, why not every other day? Because healing takes time to adapt, not just react. Shockwave is a strong signal. You want the tissue to remodel between this. Can I keep training or walking? Absolutely, as long as it's structured. We will guide your reps, sets, and pace so you can build, not break down. What if I only feel better for a day? Then we adjust. We tweak the dose, the spacing, or loading. Progress should be consistent, not random. So here's the bottom line. Once a week works, and that's why it's common, but it's tradition, not a rule. Tendons every 5 to 7 days or 3 to 4 for athletes. Muscles every 2 to 3 days. Arthritis starts 7 to 10, shift 5 to 7 as you improve. When you time your care to your biology, your age, and your goals, you heal stronger and you keep it. Pain is data. Let's decode it. If you want this mapped to your body and your week, here's what to do next. Book an evaluation here at HealthFit. Call 626-365-1380 and we'll walk you through it, or download your free guide on regenerative therapies to see how this fits into your recovery plan. You don't have to plan your life around pain anymore. If you're ready, I'm in your corner. Let's build a plan that fits your life. Less pain, more living. That's the point. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.